Hello, my name is Brittany. I've been a nurse since 2010, and I've been in labor and delivery my entire career. So that is the basis of my PICOT and my project. My PICOT question is simply this. In postoperative C-section patients with acute pain, how does scheduled administration of pain medication compared to PRN medication administration affect pain scores on a scale of 1 to 10 during the first 48 hours after surgery? And the reason this is important to me is because I personally have 3 kids, and I know what it's like. Those first few hours, first few days are the most difficult. And, Maslow's hierarchy of needs teaches us that if we don't have our basic needs met, it's really hard to take care of others. And so that's why this is so important to me, because a mom that is in pain can't eat, can't sleep, and everything becomes so much more difficult. Last year, 32% of all deliveries in the United States were done by C-section. And 65% of those patients who underwent a C-section experienced pain. I believe that number is probably higher, but that is what I found. Postpartum pain affects bonding, healing, and overall maternal satisfaction. And we nurses know that if pain is allowed to escalate, it becomes harder to control. My SWOT analysis is my strengths are strong leadership, positive community reputation, and cohesive staff. So great strengths there for the hospital. Also some more hospital opportunities here are some maternal satisfaction, increased scores on surveys, and social media. Weaknesses would be, my biggest fear would be the resistance of the physicians to change, and then also outdated technology. Threats would be intense competition, and then also patients' resistance to taking scheduled pain medication. So key steps in comparing PRN versus scheduled would be to gather data equally based on order sets. And this would be PRN versus scheduled. We would compare the pain scores on a scale of 1 to 10, keep that really consistent. We need to ensure that those with scheduled pain medication receive scheduled doses in a timely manner. Timeline, I anticipate 3 months to gather data, 1 month to present information to stakeholders, and 1 year to implement new pain medication orders. The 2 components of the CLAFH framework that I identified for my project would be technology and data, focused and culturally responsive. Data will be used to present results, and although the pain scale is subjective, the 1 through 10 scale will be used for scheduled and PRN pain medication. And that is the best way to keep it consistent, even though we're using something that is subjective. And then in order to be culturally responsive, the 1 through 10 pain scale allows us to broadly across the board, regardless of culture, gather pain scores. We can use visual aids, all sorts of way to gather just a very simple number representing their pain. And then pain medication administration is unbiased in helping those with pain. My vision for change is that scheduled pain medication becomes the new norm. Staff nurses come to expect scheduled pain medication orders. Physicians change their standing postpartum C-section orders to include scheduled pain medication. Hospital administrators, including the nurse manager, OB chief, and CNO, all support the plan to have scheduled pain medication orders. For implementation and delivery, the charge nurses and key staff members will be able to assist the physicians in changing their order sets. I think the biggest reason why I'm going to have resistance is because the physicians don't have time to sit and change their orders. They don't want to do it. So if we have key staff members willing to just help them do it real quick, I think they'll be more likely to get on board. I'm going to provide stats from the study to the physicians, the staff nurses, and I'm hoping that will help facilitate buy-in of this new the new orders, and then communication will be sent to all staff nurses to expect new order sets that include scheduled pain medication for C-section patients so they don't miss it. Benefits: the patients will benefit the most. Reduction in chasing pain, reduction in patient guilt or stigma in asking for pain medication, increased maternal comfort and bonding, and increased maternal sleep. Risks: physicians' resistance, staff resistance, and patients disbelieving in the objective of staying on top of the pain. Implications for nursing practice. This change reiterates the need for patients to come first. I chose the ANA Code of Ethics to review and support my project, and I picked out a couple of provisions. Provision 2 states that a nurse's primary commitment is to the recipient of nursing care, whether individual, family, group, community, or population. And this is applicable here because it's not only the patient, but it's the husband or the significant other. It's the kids. It might be the newborn baby or all the kids. And then provision 4, nurses have the authority over nursing practice and are responsible and accountable for their practice, consistent with their obligation to promote health, prevent illness, and provide optimal care. Over the course of 3 months, the pain score will be collected, and an average pain score will be taken. Scheduled versus PRN. The same pain score will be consistent with scheduled versus PRN. A pain score of 1 through 10 will be used, and surveys will be conducted among staff nurses to gather their input on the effectiveness of scheduled versus pain. So not only gathering information from the patients, but also the staff nurses to see if they notice a difference too. Ethical considerations include balancing pain relief with potential side effects and maternal autonomy. The patient should never feel like we are forcing pain medication on them, and we have every right to decline the medication. And that's really important here. I don't want this to come across as that we're, forcing pain medication down the patient's throats, but we need to make sure that they are educated into the why of why this might be important for them. Legal issues may involve the use of opioids and misuse. I am proposing that with scheduled pain medications such as NSAIDs or Tylenol, or some combination that may include dexamethasone. I saw a study that included dexamethasone that was given as an adjuvant to NSAID or Tylenol, and it completely reduced the need of opioid or made it non-existent. Nurses should adhere to professional standards of care when assessing and treating pain. The standard 1 through 10 pain scale should be used, and non-opioid medication used first. And that's really important. So one thing I wanted to mention too is if pain escalates too much, it becomes harder to manage. And this is why PRN pain medication may not be effective. Patients often don't request pain medication because they want to be tough or they don't want to bother the nurse, allowing the pain to escalate beyond an acceptable state. Scheduled pain medications such as ibuprofen and or Tylenol would help alleviate these common issues. And then, at a BC, you can see, excuse me, one of my research articles that I just wanted to touch on real quick out of BC et al. States that optimal perioperative pain management will not only allow the mother to ambulate early, but also plays a key role in the postoperative rehabilitation, relief of suffering, shortened hospital stay, reduce hospital costs, increase maternal satisfaction, and bonding between the newborn and the mother. And that, to me, is just what is so important here. Let me stop this. And the last thing I wanted to touch on is just, some of the insights that I've gained throughout this course is the stakeholders, who they are and why they're important. It makes me look at everybody versus just like the nursing staff. I've also learned about how much planning goes into preparing a change project that includes the PICOT question, the SWOT analysis, the SMART analysis, and just how much goes into this. and why it's important. And these analyses in this class have allowed me to have a broader, more comprehensive understanding of change and why stakeholder buy-in is so important. So I hope you enjoyed my presentation.